There is near anonymous support that climate change is both real and intensifying. Major changes in hydrological and geological cycles of the Earth, which is caused largely by human activity, is already having a significant impact on many of the Earth's geographical features. Take, for instance, the Arctic and Antarctic ice shelves, which are disappearing at an alarming and nonlinear rate. Certain forecasts predict that the Arctic will be ice-free by 2020, although many climatologists say this will happen much sooner. Also noted is an increasing occurrence of flooding events such as typhoons and hurricanes. These are becoming increasingly common among coastal areas and Southeast Asia. We are also bearing witness to the intensification of drought periods, such as in Gujarat, India, Australia, and more recently, California. Environmental scientists say that we need to curb emissions if we are to protect ourselves from these cataclysmic and irreversible changes in the environment. And yet, systems ecology teaches us that feedbacks in the environment between emissions and changes in weather are not immediately apparent. That is to say that if we didn't cut emissions tomorrow, the effects from emitting today would not show up for several weeks, days, or even months later. Adding to the uncertainty are the persistent and reoccurring failures in global climate talks, such as Rio+20 and Copenhagen. As mentioned by the Institute of Mechanical Engineers, curbing emissions is not likely or possible in the near future. The question then remains, what consequences will arise from not curbing our emissions? In regards to global environmental change and what has been termed climate change adaptation, environmental scholars have put a lot of time and energy in the concept of resilience. That is how people and places can adapt, i.e., buffer or bounce back from disturbances in the environment. Much energy has been spent focusing on technologically based solutions, such as the construction of flood dams and levees that prevent waves from crashing violently on beaches. Other solutions have been more management-focused, seeking primarily to lessen the pressure on natural resources. For example, using corn as a means to feed populations at the same time as providing biofuels. While many methods have been sought for climate change adaptation and cultivation of resilience, less thought has been given to the social side of things. This is especially true in regards to the human and health dimensions of a changing environment. Take, for example, the impact of ever-increasing global temperature averages. This continues to dramatically increase the geographic beating grounds of disease-carrying insects. Dramatic increases in extreme weather, storm surges, hurricanes, and typhoons will increase the risk of contaminating local water supplies. This is problematic given that rates of transmission and infection will then become more commonplace amongst an ever-migrating world. Other changes in the environment present their own set of challenges. It is said that heat waves will quadruple by the year 2080. The projected increase in severe hot and cold weather will disproportionately affect the most vulnerable of populations, such as the poor, the homeless, and the elderly. The stress mounted from such exposure will increase production of blood glucose that will worsen the symptoms of those with type 2 diabetes. Increased stress from prolonged heat and cold exposure will also increase rates of gun violence and aggression. Air pollution will compromise the cardiovascular and immunological health of people that will cause 120 deaths per year in Toronto alone. For these reasons, climate change has been called the single biggest public health challenge of the 21st century. As seen before, the climate health problem is inextricably linked to issues of social equity and human rights. In a world that is ever adapting to a changing climate, a world that is only beginning to understand the human health consequences, we do not want to risk the short-sightedness of slowly attending to infectious and physical disease control. Just take a second to reflect on the stress and gun violence scenario. We should seek to examine what this actually entails. Oftentimes, gun violence is perpetuated by those suffering from some sort of mental health problem. And indeed, psychological consequences is exactly what's at stake here. International agents like the World Health Organization have said that psychosocial consequences of climate change are an urgent and unprecedented issue. Moreover, the American Psychological Association said that mere biophysical perspectives on climate change must move towards and integrate mental health and psychological perspectives as well. Even actors like the Union of Concerned Scientists, who typically approach climate change adaptation through the lens of clean energy and renewable technology, have said that anticipating, quantifying, and addressing the mental health impacts of climate change is now a priority research area. So, where do we even start? Just what are these direct and indirect mechanisms? A few, but growing number of case studies have enhanced our understanding. From flash floods in Great Britain to the hurricane that devastated New Orleans, to reoccurring multi-year drought in Australia and irreversibly changing Arctic landscapes of northern Labrador. Take, for example, Hurricane Katrina, from which 1.2 million homes were affected, and 800,000 people were forced from their homes. Meanwhile, mental health problems doubled among displaced survivors. Similarly, a flooded municipality in south of England found psychological distress to amplify by a factor of 4. In both American and British cases, post-traumatic stress disorder rose to a quarter of the population following the disaster. The Australian zone, open-cut mining, environmental degradation, and drought has led to an exponential growth in suicide amongst rural farmers. Meanwhile, in the Canadian Arctic, the inextricable connection to the land, which is disrupted by climate change, continues to wreak havoc on the mental health status of the local populace. Effects are made worse by long-lasting socio-political stressors, like the residential school system. For these reasons, scholars like Ashley Consola Willox has dubbed climate change as a colonial legacy. Looking to explain these phenomena, environmental philosopher Glenn Albrecht coined the term solastalgia. He conceived the existence of an ecological unconscious, which posits that our very health and well-being is contingent upon healthy relationships with the natural world. Briefly defined, solastalgia refers to the emotional loss following displacement from or disruption to one's homeland. Originally posited with land-based people in mind, people who rely upon their environment for both food and identity, Albrecht's work has helped to provide compelling evidence for the mental health climate change connection among diverse world populations. Of course, mental health consequences of climate change must pay respect to geographically specific factors. Nonetheless, a handful of variables remain common across regions. For it has been said that psychosocial responses to extreme weather are relatively similar across natural and cultural contexts. One of the most common psychological consequences of climate change result from, or are made worse by, 1. A loss of economic assets. Worldwide, $370 billion was lost in the year 2011 alone. $2.4 trillion has been lost since 1971. 2. Compromised food security. Anxiety, conflicts, or worse stem from a lack of stable foods. 3. Death or displacement from loved ones and loss of social ties. Imagine the emotional devastation caused by the 147,000 deaths lost from hydrological and meteorologically related reasons in the past 10 years alone. Although the evidence is just beginning to surface, any combination of 1 through 3 can reduce people's ability to cope. This can lead to eventual drug use, alcoholism, and ever-reoccurring stress. Those who are already homeless or have pre-existing mental health problems will be even more likely to turn to ineffective coping mechanisms such as drugs. Examination of hospital admissions records also shows some interesting findings. Organic mental health problems, that is, mental health problems with a biological basis in the brain, such as schizophrenia, mood, and multiple personality disorder, are exponentially higher following an extreme weather event. Many psychological assessment tools used by medical professionals do not include environmental determinants of mental health. Those with PTSD, acute or generalized anxiety following environmental catastrophe, are often not prioritized in the same way as dengue fever. In face of these setbacks, it then becomes a question of what other barriers prevent the mitigation and containment of psychosocial consequences. The science says that public health agencies have a central role to play, for they can help diminish patron risk. They can identify risk factors for marginalized people and offset burdens for hospitals. In rural areas, public health's capacity remains rather lackluster, however. Meanwhile, in large urban centers like Toronto, public health departments are not well coordinated with other actors who are concerned with broad human health consequences of climate change. These can include agencies like mental health, social service, emergency management organizations, which often exist in silos. This siloism is driven by different mandates, lack of incentives to collaborate, and unclear responsibilities among actors involved. Moreover, mental health agencies face their own set of challenges. Many face recurring problems with funding and fiscal austerity. This often means that the mental health outreach workers who are deployed following an extreme weather event lack the capacity to search entire neighborhood blocks, even if they can search apartment buildings. This scant amount of attention and resources paid to mental health specialists is also reflected in climate change adaptation panels. The City of Toronto, who is considered a global leader in climate change adaptation, does not include mental health professionals in the development or administration of municipal-level climate change adaptation plans. This is startling given that psychological consequences will soon exceed physical consequences. Not all is doom and gloom, however. In 2005, the province of Ontario set up a psychosocial emergency task force, which was composed of mental health agencies and professionals that could be mobilized following a disaster. Despite their stupendous efforts following the Quebec ice storm of 2013, this task force has been recently disbanded. It thus appears that many systemic barriers must be overcome if we are to meet this growing need for a psychosocial mental health team and emergency response plan. This requires increased political will and a supportive medical and psychiatric community. So far, psychiatric communities have been reluctant to take psychological casualties of climate change seriously. Also needed is greater enthusiasm among public health agencies. They must expand their focus beyond the mitigation and containment of climate-related infectious diseases. Public health agencies must find a place where psychosocial services can become both recognized and supported.
Well, that seems like a long list. Where do we even begin?
In certain ways, this is ultimately an issue about changing mental models. That is, changing thought processes, affects, and attitudes about how something exists in the world. It is about shaping and driving behaviors. It is about getting psychiatrists, public health agencies, to consider the repercussions of not taking the psychosocial consequences of climate change seriously. With better information produced by sound research, more funding can be provided, which will lead to more action. While priority areas of research are starting to be identified, we need to show the economic costs of not doing anything. We need to quantify the costs, economic, social, of not developing a psychosocial response plan or having the right psychological services in place to help people with climate-induced suffering. These sorts of cost-benefit scenarios have already worked effectively for tobacco control programs worldwide. It was this sort of costs per dollar research that banned smoking in public places like schools and restaurants. If we were to show the economic costs here, policymakers would be much more compelled to create the necessary policy changes. Luckily, the City of Toronto is on the right track in certain respects. Directed by the psychosocial response lead, Alan Dick, a family reunification plan can reunite families after environmental strife. The Canadian Red Cross also offers personal preparedness workshops. Anecdotal evidence suggests that many homeless and other marginalized people have been receptive to it. Once immovable middle-class folks have become increasingly engaged with the Red Cross material as well. These preventative strategies will ultimately reduce the burdens upon hospitals and other healthcare providers. While all of these necessary changes might appear daunting, you are much more powerful than you think. Many indirect mechanisms work just as well, if not better, than solutions mentioned above. Intentionally creating and engaging with community, your neighborhoods, schools, and workplaces can give a leg up to those who need it. Together we can offset climate change's ability to negatively affect the psychological health of those around you. Always remember to reach out to those who need it. All real change starts from here.